morning, everyone. Hello. Bonjour à tous. Merci d'être des nôtres. Before we get into things, I have two pieces of news to share with everyone. The first one is about the distribution of critical equipment to provinces and territories. For the past few weeks, our government has been working closely with industry to produce the supplies our healthcare workers need, like masks, face shields, gowns, ventilators, and test kits. Well, today I can announce that our government has signed an agreement with Amazon Canada to manage the distribution of this equipment to the provinces and territories. Aujourd'hui, j'annonce que notre gouvernement a conclu une entente avec Amazon Canada pour acheminer du matériel médical aux provinces et aux territoires. Amazon utilisera son grand réseau de distribution pour assurer la livraison d'équipements médicaux là où on en a le plus besoin. La deuxième nouvelle dont je veux vous faire part ce matin est en lien avec l'armée. On a reçu une demande du gouvernement du Québec pour une intervention des forces armées pour prêter main forte aux communautés nordiques et isolées. Comme je l'ai dit plus tôt cette semaine, nos membres sont toujours prêts à aider les communautés à lutter contre la COVID-19. Je peux donc confirmer que les forces armées seront là pour les Québécois comme pour tous les Canadiens. Depuis quelques semaines, la COVID-19 chamboule les vies. On fait l'école à la maison, on réduit nos déplacements, on reste chez nous le plus possible. On vit tous les conséquences de la pandémie, mais certaines familles traversent des moments encore plus difficiles et plus incertains. Si vous avez perdu votre job, si vous recevez plus votre chèque de paye, vous vous demandez non seulement comment vous allez payer vos factures à la fin du mois, mais l'épicerie le lendemain. Across the country, there are food banks that can help. But like most organizations, food banks are facing new challenges because of this pandemic. With everyone staying home, they have fewer volunteers. And a difficult economic climate means that they're receiving fewer donations that they normally would, while demand rises. The staff at the Neighbor to Neighbor Food Bank in Hamilton told us they're getting more and more calls. And it's overwhelming for the volunteers who are spread really thin and working overtime to help their community. The work being done by food banks and their volunteers is essential, so there's no question that they need more support during this crisis. If you have the time and ability to help, reach out to your local food bank and ask them how you can help them. At the same time, I'm announcing that the government will provide $100 million to meet the urgent food needs of vulnerable Canadians, including those living in Indigenous and Northern communities. This money will help ensure that organizations can buy and deliver food to those who need it the most. It will help support organizations that you may already know, like Food Banks Canada, Breakfast Club, and the Salvation Army, and many more. And on that note, I do want to take a moment to thank all volunteers and organizers. Thank you for feeding our communities. We see you, and we are grateful for the incredible, tireless work you do, even in these extremely difficult circumstances, especially in these extremely difficult circumstances. You are doing essential work for our most vulnerable. You are showing what it is to be Canadian, to be there for each other in times of difficulty. Aujourd'hui, j'annonce que le gouvernement investit 100 millions de dollars pour répondre aux besoins alimentaires urgents des gens les plus vulnérables, y compris ceux qui vivent dans les communautés autochtones et nordiques. Ces fonds aideront les banques alimentaires à acheter et à livrer des provisions à ceux qui en ont besoin. Depuis le début de la pandémie, les banques alimentaires font face à des défis particuliers. Par exemple, la plupart de leurs bénévoles sont des personnes à la retraite qui sont plus à risque d'attraper la COVID-19. Ça veut dire moins de monde pour desservir une clientèle grandissante. Les banques alimentaires et les organismes de bienfaisance font un travail incroyable pour nos communautés à l'année longue. Je pense par exemple à la maison de quartier Villeray, que je connais depuis bien des années, où les gens travaillent extrêmement fort pour aider leurs voisins dans mon comté de Papineau. Si vous avez le temps, est le moyen d'aider ces jours-ci. Je vous invite donc à communiquer directement avec les organismes autour de chez vous. Ils ont besoin de votre aide. Et avec l'annonce aujourd'hui, on appuie plusieurs organismes que vous connaissez peut-être déjà, comme Moisson Montréal, le Club des petits déjeuners et l'Armée du Salut. Je veux d'ailleurs en profiter pour remercier tous les bénévoles et les organismes pour leur travail. Vous nourrissez vos communautés. On apprécie énormément tout ce que vous faites. C'est pas facile. Il y a énormément de demandes. Vous êtes limité dans vos ressources. Mais je sais que vous allez continuer d'aider vos voisins, d'aider les gens qui en ont besoin. C'est ce qu'on fait dans des moments de difficulté. On est là, les uns pour les autres, et nous serons là pour vous. Je sais que vous êtes nombreux en ce moment à traverser des moments difficiles. La pandémie crée beaucoup d'incertitudes et ça vous inquiète. Mais je veux que vous sachiez que notre gouvernement ne va pas vous laisser tomber. On a investi dans les banques alimentaires pour que vous puissiez subvenir aux besoins urgents de votre famille pendant cette crise. Et en même temps, on offre un soutien financier à ceux qui ont perdu leur emploi ou leur chèque de paye à cause de la COVID-19. On met en place la prestation canadienne d'urgence qui vous donnera 2 000 $ par mois. Notre gouvernement augmentera aussi le crédit pour la TPS pour aider les gens dont le revenu est faible ou modeste. On avait dit que les adultes admissibles recevraient jusqu'à 300 $ et jusqu'à 150 $ par enfant à partir du mois de mai. Mais je peux maintenant confirmer qu'ils recevront de l'aide ce mois-ci, en avril. Our government is also supplementing the GST credit to help low-income people. We had said that in May, every qualifying adult would receive up to $300 with $150 for each child, but I can now confirm that help is coming sooner, this month, in April instead. Our government has also been working with major banks to deliver benefits, including the CERB, through direct deposit. Effective today, people should visit their bank's website for information on how to enroll for direct deposit if they haven't already. Je sais que vous êtes nombreux à vouloir savoir combien de temps ça va durer. Vous vous demandez quand est-ce que vous allez pouvoir voir vos amis, serrer vos grands-parents et recevoir de la visite pour le souper. Hier soir, je me suis entretenu avec les premiers ministres des provinces et des territoires et on a notamment parlé du partage de données et des projections. La bonne nouvelle, c'est qu'on teste beaucoup plus de gens et les experts ont des nouvelles données à analyser. Les provinces et les territoires sont en train de mettre leurs données à jour et publieront les dernières informations bientôt. De notre côté, on travaille très fort pour vérifier les derniers chiffres pour pouvoir ensuite les mettre en ligne. Vous pouvez consulter le canada.ca/coronavirus pour obtenir les meilleures informations à jour sur les propagations du virus. J'aimerais pouvoir vous dire exactement quand tout sera terminé. Je vous parle souvent de semaines et peut-être même de mois, mais la réalité, c'est que ça va dépendre de chacun d'entre nous. La meilleure façon de minimiser l'impact de la COVID-19, c'est de continuer à suivre les directives des experts. Vous les connaissez. Restez chez vous le plus possible. Limitez vos déplacements. Et si vous devez absolument sortir de la maison, gardez une distance de 2 mètres avec les autres. Continuez à faire votre part et je vous promets qu'on va passer à travers. Je veux terminer aujourd'hui avec un message pour les jeunes et les enfants. Dimanche, je vais faire une vidéoconférence axée sur vous avec la Dr Tam. Vous pouvez m'envoyer vos questions aujourd'hui sur le site de Radio-Canada Jeunesse et j'ai hâte de vous répondre en fin de semaine. I want to close with a message for kids. On Sunday, I'll be holding a video conference focused on you with Dr. Tam. So send me your questions through CBC Kids' websites by the end of the day, and I'm looking forward to answering you this weekend. Merci beaucoup tout le monde.
Thank you, Prime Minister. We'll now go to the phone lines for a few questions. One question and one follow-up. Operator?
Thank you. Merci. First question, Kate Bolingaro, Bloomberg. Your line is open.
Hello, Prime Minister. I have a question regarding the OPEC. Is Canada planning to meet with, has been invited to meet with, or party and talk to?
I'm sorry, Kate, your line is cutting out a little bit. Can you try and speak closer to the phone and a little more clearly?
Yes, no problem. Can you hear me now, Mr. Prime Minister?
That's much better. Thank you.
Okay, so my question is regarding the OPEC Plus meeting on Monday. Is Canada planning to meet with, has it decided to meet with, or is it already talked OPEC other oil producing nations about coordinating output levels to help bring crude prices down, and what would you have to potentially look like?
I can assure you that we've been coordinating closely with the United States and other allies in looking at the challenges faced by OPEC right now. We recognize that these catastrophically low oil prices are having an impact on many people's economies and indeed on Canadian oil sectors. We're trying to coordinate to ensure that we make sure that our economy doesn't face the kinds of challenges that it's been facing. We need to continue to support workers across the country. We will continue to work internationally to try and impact on the difficult decisions made by OPEC over the past weeks, and we will keep you posted on that.
And what is happening with the support package for the oil sector we've been hearing about?
We're continuing to work with provinces, particularly the province of Alberta, to ensure that we're giving support to workers who are in particularly distressed industries. The wage subsidy and the Canada Emergency Response Benefit will be of help to people right across the country, including in the oil sector, but we recognize that certain industries are facing much greater stresses than others, and we will continue to work with the provinces. I can highlight that in our conversation last night, the premiers and I did discuss this. I heard directly from Premier Kenney and others on the importance of support to the oil sector, and we're going to continue to work with them.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Bonjour, M. Trudeau. On apprend que l'administration Trump a demandé à 3N de cesser d'exporter des masques N95 au Canada, en Amérique latine également. Pouvez-vous nous donner plus de détails sur ce que vous savez? Comment qualifiez-vous cette décision-là? Et puis, comment est-ce que le Canada compte y réagir?
On est en train de travailler très étroitement avec les États-Unis pour qu'ils comprennent ce que nous, on sait très bien déjà, c'est que les échanges entre le Canada et les États-Unis vont dans les deux sens, particulièrement pour les biens essentiels et pour le personnel médical. Il y a des milliers d'infirmiers et d'infirmières à Windsor qui travaillent au Détroit à chaque jour sur lesquels les Américains dépendent. Il y a des produits médicaux et essentiels qui vont dans les deux sens à travers notre frontière et ce serait une erreur pour nos deux pays de limiter l'accès de l'un et l'autre à des produits et du personnel nécessaire de l'autre côté de la frontière. C'est ce qu'on est en train de souligner et on va continuer de travailler pour s'assurer que ce dont on a besoin va arriver. Okay. We've been working very closely with the Americans to highlight what Canadians know very, very well, that the level of integration between our economies goes both ways across the border, that we are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods, across our border. That is the point we're making very clearly to the American administration right now.
And a follow-up, Melanie?
Hier, M. Trudeau, vous deviez faire le suivi avec Washington concernant le détournement de matériel médical, des masques qui sont achetés sur le tarmac. Qu'est-ce que vous leur avez dit? Qu'avez-vous appris? Puis juste pour revenir aussi à la question à laquelle vous n'avez pas répondu, est-ce que le Canada va riposter en refusant lui aussi d'envoyer des masques aux États-Unis si on en envoie effectivement?
Nous allons toujours chercher à continuer le commerce ouvert et essentiel avec les États-Unis. On dépend tous les deux du commerce et des échanges de biens et de services essentiels de chaque côté de la frontière et nous allons travailler pour s'assurer que ça continue à être possible et être encouragé dans ces moments de difficulté. Nous allons toujours faire des suivis sur des préoccupations par rapport aux livraisons, mais pour l'instant, on est confiant qu'on continue à recevoir ce dont on a besoin.
Thank you. Next question, operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star. Line open.
Tonda, you might be on mute.
Yeah, I am. Sorry. Thanks for taking the question. Can you clarify? Last night, this order came from Trump to 3M company to cease their exports to Canada, and you've talked about how valuable it is. But have you, since then, put in a call to the president? Do you have one planned today? And you said it would be a mistake, but it's a done deal, is it not?
3M has indicated that it understands how important it is to continue with delivering on orders to places like Canada because there is much trade that goes back and forth in essential services, and it could end up hurting Americans as much as it hurts anybody else. That is the point that we are making very directly and have been making for many days now to various levels of the American administration, and that message is getting through. 3M a indiqué que ce serait une erreur de limiter le commerce en matériaux essentiels parce que tous les pays ont besoin de recevoir du matériel d'en dehors de leurs frontières et ce serait blessant pour les Américains d'avoir des limites sur les biens essentiels qui arrivaient du Canada et d'autre part. C'est une chose qu'on est en train de souligner très fortement avec l'administration américaine ces jours-ci, y compris ce matin.
As a follow-up, sir, you didn't indicate whether you have or will speak to the president today, but I'd like to understand from your perspective just how big a gap this leaves Canada's supplies of these crucial medical masks.
We continue to be confident that we're going to receive the necessary equipment. We understand that there are pressures across our healthcare systems in various regions on the dwindling supplies. That's why we are working so hard to ensure that we get the right supplies to them in the right amount of time. We've seen a number of Canadian companies stepping up their productions, which will be flowing soon. We're also receiving more shipments from places around the world. We will do everything we can to ensure that no part of Canada goes without essential supplies in facing this pandemic.
Thank you. Operator, one more question on the phone, please.
Thank you. Merci. Justin Ling, freelance. Your line is open.
Hi there, Prime Minister. You've been imploring people to stay home if they can. You've been asking people not to go to work. But given that, why are you still sending in civil servants to run immigration detention facilities when that could seriously increase the risk of spreading the virus not only to those detained in the facilities, but to those workers who have to go back home to their families every day? Do you consider that an essential service to be locking up people who were applying for asylum here?
We recognize that there are many essential services that need to continue to be delivered for Canadian safety, for the well-being of our country, and ensuring that Canadians are safe needs to be a top priority. That's why we're going to continue to ensure that essential services get done wherever possible. Civil servants are encouraged to work remotely, to work from home. We know there are significant things that need to be worked on to deliver for Canadians, to keep Canadians safe at this particular time. And I want to take the opportunity again to thank the public service for all it does in these difficult times to make sure Canadians are kept safe and secure.
Well, it's not really a question of safety when you're locking up those who may have overstayed a visa or who applied for asylum. And certainly, it's been 2 weeks now since I first asked you about releasing nonviolent offenders, and nothing has happened. Your government has continuously said, you're looking at it, everything's on the table, you're looking at it, but nothing's actually happened yet. Why are you dragging your feet, and why has action not been taken yet?
I can actually inform you that action has been taken. We've been working closely with Corrections Canada and detention facilities of all types to reduce the vulnerability to the spread of COVID-19, to ensure that measures are in place to keep Canadians safe. We continue to look at other measures that can be taken, and we will take those measures in due course.
Brian Mullen, Global News. Prime Minister, on the issue of 3M, you're saying if the U.S. goes ahead with this, it could hurt Americans also because of the flow of supplies and resources across the border. Are you considering any retaliatory measures against the U.S.?
We are discussing very closely with the United States the importance of keeping the flow of essential goods and services across our border to help both of our countries. I am confident that the close and deep relationship between Canada and U.S. Will hold strong, and that we will not have to see interruptions in supply chain in either directions. Okay. Nous allons continuer de souligner aux Américains à quel point c'est dans nos intérêts de chaque côté de la frontière de continuer à partager des biens et services essentiels. C'est quelque chose qui est très important pour nous tous, et c'est pour ça que je suis confiant qu'on va pouvoir continuer de compter l'un sur l'autre dans cette crise importante.
Glenn McGregor, CTV News. Prime Minister, within the hour, Ontario officials are going to reveal their projections on the number of cases and the number of fatalities we might expect in the province. Dr. Tam has said the federal equivalent of those models are being used to inform your policy decisions, require Canadians to dramatically alter their way of life. Don't you have an obligation to follow Premier Ford's lead and release projections on the worst case and best case scenarios about how many of us might die?
We have been releasing information every single day on data received from the provinces, updating it regularly on websites so Canadians can see the latest numbers and look at various models that use those numbers to make various projections. At the same time, we need to make sure that the projections that we will be releasing are based on the most accurate, the deepest, the most properly collated information out there. We are working with the provinces to be able to build a robust model to give the projections that people want to see. People are wondering, how much longer is this going to last? How many Canadians are going to be severely affected? These are things that we will be sharing with Canadians, but we need to make sure we have a better grasp on the accuracy of the data before we put projections out there. Okay. Nous reconnaissons que les Canadiens veulent savoir combien de temps ça va prendre, qu'on va devoir continuer cet isolement, combien de Canadiens vont être affectés, combien il y aura de décès. Nous allons partager cette information, mais avant de pouvoir le partager, il va falloir qu'on se base sur des données très précises et meilleures que ce qu'on a maintenant. C'est pour ça qu'on est en train de travailler avec les provinces pour approfondir nos données pour pouvoir livrer un modèle qui est beaucoup plus ancré dans la réalité.
Marika Walsh with the Globe and Mail. I just want to return to the OPEC questions you were asked at the top. Can you clarify, is Canada at the table at Monday's meeting, or are you just dealing with the U.S. and the U.S. is the one dealing with OPEC?
We are continuing our conversations with the international community, including with OPEC. There have been communications between OPEC and Canada. We will continue to stress that we need to work together as a world to get through this economic crisis as well as a health crisis. We will continue to insist on that.
Okay, can you please clarify if that means Canada will actually be at the table? And also, I'd like to get your thoughts on whether Canadian producers should actually be cutting their production further. They've already had to do this. More is expected because of supply challenges. So is it a wise strategy for Canada to coordinate with a price-setting cartel that has caused many of the current problems we're seeing in the global pricing of oil?
Well, I can assure you that conversations are ongoing with the United States on how we can work together to ensure that we are countering some of the measures being brought in by OPEC, and we will continue those conversations.
Bonjour, M. Trudeau. Mathieu Goyer de Radio-Canada. On comprend que ce sont les Rangers qui vont aller dans le nord du Québec. Pouvez-vous donner plus de détails sur leur nom et leur mission particulière?
On sait que les Rangers canadiens sont toujours présents dans le Nord pour aider dans les communautés, pour aider à servir. Ce que je comprends, c'est qu'au Nunavik, les Rangers vont être là pour aider à installer des tentes et de l'infrastructure médicale. On aura plus de détails sur les nombres dans les heures à venir.
Et dans les hôpitaux, les pharmaciens craignent des pénuries de médicaments importants comme du Ventolin, de la morphine, du Curare, comme on le voit dans les hôpitaux européens. Qu'est-ce que vous faites pour s'assurer qu'on ne manque pas de médicaments dans nos hôpitaux canadiens?
On a une industrie pharmaceutique assez robuste au Canada. On a déjà passé le message de créer plus de produits qui vont être nécessaires pendant cette crise. Nous travaillons aussi avec la communauté internationale pour s'assurer qu'il n'y ait pas de pénurie dans les hôpitaux canadiens. On va continuer de veiller au niveau de ressources que nous avons pour s'assurer qu'aucun hôpital, aucun Canadien ne manque de médicaments dont ils ont besoin.
Good morning, Prime Minister. Olivia Stefanovich, CBC News. I imagine you have seen the projections from Ontario and Quebec that will be released shortly. Can you tell us what your reaction is to those numbers and how this will change the federal approach?
I'm not going to preempt the announcement that Premier Ford is going to be making shortly. We have seen the numbers. We continue to work very, very closely with the provinces. We are very much looking to share national projections with Canadians in the coming days. But I can tell you that we know that this is a very difficult situation for Canadians. There are some very challenging projections out there that will emphasize how important it is for all of us to do our part, to stay home, to keep ourselves safe, to keep our loved ones safe, and to get through this as best we possibly can.
How do these numbers change the federal approach?
Our federal approach continues to be to do everything we can based on the best scientific advice to keep Canadians safe and to ensure that our economy bounces back strongly after this is all through. The measures that we're encouraging and asking Canadians to take, whether it's around self-isolation, whether it's around social distancing, which means keeping 2 meters apart, whether it's around ensuring that people are washing their hands regularly and for 20 seconds. These are the things that are going to help keep Canadians safe. As much as we can do at the federal level, as much as we can support, as much as we can bring in quarantines and decrees, ultimately, it is Canadians' own behavior that will make the difference in this. How we get through this depends on you, and that's why I'm so confident that we will get through this, because Canadians are always there for each other. We're looking to do the right thing. We will get through this together. Merci tout le monde.